Ronald de Jong, Executive Vice President Philips and Chairman of the Philips Foundation. Peter Maurer, President of the International Committee of the Red Cross, and Rebecca Hoppy, Partner and Managing Director of Rabin Martin.
They'd like me on this side now.
Yeah, okay.
Thank you. Hello, everyone, and thank you for joining us today for a conversation between Philips and the International Committee of the Red Cross about health as a common denominator. It's my pleasure to introduce Ronald de Jong, Executive Vice President of Philips and Chairman of the Philips Foundation, and Peter Maurer, President of ICRC. To kick off, we'll start by sharing why both Philips and ICRC are here at the Social Good Summit in 2017. Ronald, let's start with you.
Well, what we believe is that the world is getting a very complex place. And that in order to make sense out of the complexity, we need to work together with parties that have a common understanding of what needs to happen and that can be complementary in making an impact. As Philips, we are committed to bring innovation to the market and with that improve the access to healthcare, reduce the cost of healthcare, do that also in fragile settings. And that is where we team up with the International Red Cross organization, where we bring the knowledge in terms of clinical know-how and design know-how, and the Red Cross knows what is needed in the field, has access to the ground troops.
Peter?
Well, very much I can connect here. We are a frontline organization working in some of the most fragile and difficult situations in the world. And what we see is that the dynamic of conflict and disaster leave people in need and with a limited capacity to respond of the international community and of local actors. So the question here is how do we close the gap? And I think the concept of social goods is an excellent concept to reflect together on how we close the gap, and that's the interest of being here at that summit, and to see how can we find, by partnering with others, innovative solutions for some of the critical problems, health problems, water and sanitation problems, nutritional issues, psychological issues that people are affected to. And I think that's really the place to find multi-stakeholder alliances in order to solve find innovative solution for the problem we are confronted with. And of course, we have spearheaded some of it together with Philips.
Well said, thank you. Ronald, 3 years ago, the Philips Foundation was established. What was the rationale?
Well, Philips as a company has been around for 125 years and arguably has always been a responsible party in society. But we came to the insight that charity itself was approaching the limits of its impact and effectiveness. So we wanted to leverage, next to monetary resources, also our know-how, intellectual property, design know-how, and bring that together with the aim to contribute to the overall goal that we have as a company, which is to improve the lives of 3 billion people a year by the year 2025, based upon the innovations we bring to the market. In that 3 billion, there is a big part of the global population that lives in fragile settings, that doesn't have access to healthcare. And that is where the Philips Foundation is focusing on. How do we reduce health inequality by not only donating money, but by bringing our knowledge to the party and working together with institutions like the International Red Cross to see how we can move the needle there and provide access to healthcare to the masses.
Certainly an impressive and ambitious goal. Thank you. And Peter, tell us more about ICRC and where it is headed in your vision.
Well, we have partnered for quite some time with the private sector. And when I look at our history, it has been about philanthropy, it has been about corporate social responsibility. But I think today the problems are as big as these concepts do not work anymore to really close the gap, as I mentioned beforehand. So we need to find a new economic model which allows us to find something in between philanthropy and triple bottom line profit making of the private sector. And I think what we do with Philips is exactly this. finding innovative solutions which partner or try to combine the insights of a frontline organization, the knowledge about the dynamics on the ground, with the knowledge of the company finding solutions. And that's basically where we are headed to. But then, of course, the question is, how do we finance all those good ideas, all those pilot projects which are around here and are everywhere in the world, and we don't have the economics to do it at the present moment. And I think this is the critical challenge that we are confronted with today.
Absolutely. So that brings us to the partnership between the Phillips Foundation and ICRC, which you've both spoken about, and how you've had great success together collaborating for impact. But first, maybe we could take a look at a short video that highlights how this works on the ground.
These are some of the strongest women in the world. Not only do African women often work hard throughout their pregnancies, over 160,000 a year die in childbirth. The odds aren't good, but they face them with strength, often giving birth at home without medical care. 300,000 a year lose their babies during labor. We want to support these strong women, so we are partnering with the International Committee of the Red Cross to develop a high-risk pregnancy toolkit. It will help healthcare workers and mothers to identify risky pregnancies before they become life-threatening. It's a simple thing that can help save lives.
Innovation and you. Philips.
Thank you. It's clearly such important and inspiring work. Ronald, what makes this collaboration unique and, most importantly, successful?
A couple of things, and I will be brief. First of all, I always get good goosebumps when I see this video. I've seen it many times, but it shows that you really can make an impact on the ground. Another point I want to make very briefly is that very often people say, why is corporate enterprise engaged in these type of things other than for reputational purposes? I can assure you that no company will survive for more than a century unless it focuses its strategy on addressing the key challenges society is facing. That will ensure your long-term relevance. What we are doing with the Red Cross is bundling our know-how, our resources, our design know-how, and the knowledge of the International Red Cross, which is a frontline organization to provide solutions for people on the ground. The product that you saw, or the solution you saw on the video, is a dual fetoscope. We developed it at Nairobi, Kenya. It's low cost. It helps midwives and health workers to detect pregnancies at risk. We join forces. Red Cross has the people on the ground, and we aim to reach 75,000 women in a very short period of time. And we know that child mortality and mother mortality is a big issue. And by bringing this together to those communities, we feel we can contribute to the goal of making life a bit better.
Thank you. Peter, welcome your thoughts, and also your thoughts on how these kinds of collaborations in health fit into the broader humanitarian system.
Well, of course, this is an excellent example because it really adapted technology to some of the challenges that we are confronting on the ground. One of the big next step that we have to envisage is, of course, coming to speed and scale. I think a lot of innovation is out there which speaks to the example that Ronald just presented. And I think the big challenge today is really how do we enlarge this experience. And as an organization active in 80 countries and most of them fragile, we are really also trying to build those innovations now into standard practices, into finding responses in all the contexts we are, but also to find the ideas behind and to try to bring them into other sectors. We are working with other companies on electricity provision in mini-grids and therefore independent electricity provision for displaced populations. We are working on more high-tech solutions as well, on a mobile app which allows medical workers and health workers to detect childhood problems and in the first 5 years of their lives. We are working also on financial innovations. We just launched the first humanitarian impact bond, which is basically an effort to use the same ideas behind this innovation here and to translate also into the financial sector. How can we mobilize private money in order to direct it to the construction of physical rehabilitation center, another area in which ICRC is active? So there is a panoply of areas in which we work with the private sector, with university as well, with the science communities, with the NGO community. And that's also one of the thinking behind the creation of a global humanitarian lab, a virtual space where startups, companies, NGOs, the Red Cross movement, UN agency, all can work together in order to find some really innovative solutions to some of the big challenges we are confronted today, but also allows us then to spread and to diffuse into a broader reality of life. And this is very much, as I said at the beginning, also the purpose of us being here in this wonderful summit.
Which brings me to my last question. I think we could talk for hours about the experiences and learnings from your partnership, but you've both spoken so beautifully to the opportunity for impact when you respect and leverage the capabilities of individual organizations. But in closing, what is your message for the people attending the summit this year, and how can they get involved for social good? Ronald?
I think to answer the first part of your question, the relationship should be built on trust and complementarity. So we try to accomplish the same thing, but we have unique strengths and capabilities that we can bring to the party. And to answer your second question, what can the public at large do and contribute? We have thought a long time about the hundreds of millions of consumers that Philips reaches with its products, and we have decided we will launch it officially tomorrow. I guess I'm launching it now, right? A big initiative, we call it Better World, Better Me. Better Me, Better World. And it enables consumers, when they buy a Philips product, to register it. And then when they register it, go to a platform and indicate which of a good cause they want the Philips Foundation to make a donation to. Just imagine the power of those tens of millions or hundreds of millions of consumers that are going to vote for certain good causes. And then the Philips Foundation making donations and injecting the know-how and knowledge and capabilities to those good causes. That is a way of not only doing good, but mobilizing and creating a movement. And that's what we need to do.
Thank you. Peter, your thoughts?
Well, in today's world, what we are observing is, of course, the huge amount of tensions in economic life, in social life, in political life. I think there is one tension more which strikes me when I look into the auditorium here, and that's the tension between the angry people and the decent people. And my sense is that today we need to mobilize the decent people, because that's the constituencies with which we will find multi-stakeholder solutions, with which we can really find innovative solutions to some of the big challenges. And hopefully also to convince some of the angry people to stop being angry and hiding behind walls, but getting out and trying to find some concrete solutions. I think that's an encouragement of all guys and girls here to be here in that auditorium, and I think that's what we also hope to call on you to partner with us to find those solutions.
Thank you. Both good challenges and charges to all of us. Thanks to all of you for listening, and Peter and Ronald for your perspective today. Enjoy.